Hello and welcome to our video on the H3N2 virus. Today, we'll be discussing what H3N2 is, how it spreads, its symptoms, and how to prevent and treat it. Before we begin, I want to make it clear that this video is intended for educational purposes only. We aim to provide accurate and informative content to help increase awareness and understanding of a particular topic. We are not offering any medical advice, diagnosis, or treatment. If you have any concerns or questions about your health, please consult with a qualified healthcare provider. With that said, let's dive into today's topic. What is H3N2? The letters H and N refer to the two types of surface proteins found on the influenza virus. Hemagglutinin, H, is responsible for the virus's ability to enter and infect host cells, while neuraminidase, N, helps the virus to spread from one infected cell to another. There are four types of influenza viruses. A, B, C, and D. Influenza A and B viruses are the most common and are responsible for seasonal flu epidemics. Influenza C virus causes mild respiratory illness and does not cause epidemics. Influenza D virus primarily affects cattle and is not known to infect humans. H3N2 is a subtype of the influenza A virus. H3N2 is a highly contagious virus that can cause severe illness and even death, particularly in young children, the elderly, and people with weakened immune systems. How does it spread? H3N2 spreads from person to person through the air by coughing, sneezing, or talking. It can also be spread by touching a surface contaminated with the virus and then touching your mouth or nose. The virus can survive on surfaces for up to 48 hours, so it's important to practice good hygiene to prevent the spread of the virus. What are the symptoms? Symptoms of H3N2 are similar to those of other types of flu and can include fever, cough, sore throat, runny or stuffy nose, body aches, headache, chills, and fatigue. In some cases, vomiting and diarrhea may also occur. How to prevent and treat H3N2? The best way to prevent H3N2 is to get vaccinated every year. The vaccine is especially important for those at higher risk of complications, including young children, the elderly, and people with underlying health conditions. Other ways to prevent the spread of H3N2 include washing your hands frequently, covering your mouth and nose when coughing or sneezing, avoiding close contact with sick people, and staying home if you're sick. If you do get sick with H3N2, the best course of action is to rest, drink plenty of fluids, and take over-the-counter medications to alleviate symptoms such as fever and body aches. Antiviral medications may also be prescribed by your doctor to reduce the severity and duration of the illness. Conclusion. In conclusion, H3N2 is a highly contagious virus that can cause severe illness, particularly in vulnerable populations. However, by taking preventative measures such as getting vaccinated and practicing good hygiene, we can reduce the spread of the virus and minimize its impact on our communities.